All right, so welcome to our presentation here on the 23rd of June, 2022, on advanced East Asian medical treatment of diabetes. So yes, as Jonathan, our host, was kind enough to introduce, I'm Dr. Steve Jackowicz. I'm the chair of the doctoral program at the University of Bridgeport in Bridgeport, Connecticut, in the TCM department. So we're going to be talking today. We've got a 2-hour seminar ahead of us, and this seminar is open to everybody. It is also the kickoff for a 10-session um, 10-session program where we'd go into more detail. So I'll mention that. So hopefully the things that we do today are of interest and you'll be interested in going on and doing the rest of it. But this is also intended to stand alone and give you some insights, understanding, and technique that you can take into the clinic and you can use right away to help the patients who have diabetes. Okay, so that's the plan, right? So we're going to be talking a bit. We're going to be going over technique. We're going to have some time for questions and answers. So that's our plan ahead of us for this time for me in the afternoon, for you guys in the evening, because I'm coming to you from the East Coast of the United States. All right. Okay, so let's share the screen first. And where is there it is, hiding on me. There we go. Okay. All right. So here's our slideshow. And we're not only going to be on PowerPoint slides, but we'll start with some of those. Now, the aspect of diabetes, please realize that diabetes is a Western disease, and diabetes is actually a name for a family of diseases in Western medicine. And we're not going to go heavily into Western medicine because although Western medicine is a wonderful thing in many ways, it's not what we practice. But the patient doesn't come in and say, oh, I have 小克. They don't come in and say, I have wasting and thirsting. They rather come in and say, oh, I have diabetes. So we have to be a little familiar with that. But please realize that diabetes does represent a family of diseases. There's diabetes mellitus is most common. Diabetes insidious is another one. There's other variations of it. And so, if we just talk about that and only looked at the Western side of it, we could spend many hours discussing that, and that's what an endocrinologist does. Nonetheless, we're really talking about it from the East Asian medical perspective. And so there's a category of traditional disease. Now, in TCM, there's different systems of analysis. So one of the systems for analysis is, say, yin yang, or the 8 parameters, or one of the systems of analysis is 5-phase. Those are systems of analysis. Now, in the traditional 12 systems that are used and maintained in modern TCM, because modern TCM is what most of us have been trained to practice. When we talk about classical medicine, this modern approach is derived from the classics. So in the classical approaches, you see many different systems that didn't survive to the modern day, one of which being demonic possession. Oh, 1,000 years ago, that was a valid part of the medicine and how often mental illness was treated. We don't really use that as much now. So that doesn't mean it's bad. So the modern approach isn't bad. It just is not exactly the same as what was done 1,000 years ago. And that's all right, because all of us have studied math. We've all studied biology. We've all studied Western modern sciences. We think in a modern way. We're talking with the magic box of the computer through Zoom. So we embrace the modern parts of it. But we don't want to let our modern ingenuity throw away the wisdom of the past. That's why we study this traditional stuff. Okay, so we've got to be aware of that. So realistically, diabetes is a modern Western term. It falls into the Chinese category called 小克, Xiaoke, written in the pinyin, in the Western letters. Now, 小 means to reduce, to wear away, and 克 means to thirst. So what we got to talk about first is, what does that mean? Like, how does that relate? And it's actually called 小克病, which means the disease of wasting and thirsting. And anything called a disease or a syndrome in TCM is a set of expected and reproduced recurrent patterns that link together. And that's what we're going to be looking at now. Because these patterns are very fundamental, but they're kind of advanced. And they're not exactly the same way you see foundational issues. So what do I mean by all that? Well, here is a very simple idea. Now, everything starts simple and gets complicated. So the first simple idea that you're already aware of is yin and yang. You all know about yin and yang. It's one of the first things you studied when you went to TCM school. is the idea about yin and yang. And they all studied the idea that yin and yang are bound together, that they integrate. And here's my little line drawing of yin and yang, that they integrate back and forth. And this is the normal integration where yang ascends and yin descends and the body goes back and forth. And if you really wanted to depict this more accurately, that little line in the middle would wave back and forth as the yin and the yang interweave with each other. And we all learned in fundamental theory, no matter where you had the class, that, oh, yin grounds yang and yang moves yin, that they work with each other. That the yang commands the yin to move and the yin holds or grounds the yang down. Sometimes said poetically that the yin is the mother that holds the yang down. Great. We also learned in fundamental theory ideas, if yin becomes deficient, there'll be empty heat. Empty heat meaning heat with no external cause that rises up. You say, I got it. That's easy. Yeah, that is easy, right? And if yang is deficient, there's empty cold, which means not enough yang and the yin's cold. You're like, I got it. Easy, certainly. But that's not diabetes. And here's where it gets a little bit more involved. Because simply yin deficiency or yang deficiency does not explain the complexity of diabetes or of wasting and thirsting. But in a normal situation, you have this. Yin yearns to be with yang, and yang yearns to be with yin, and they combine together. That's called bing he in Chinese, right? Bing, to combine or coalesce, and he, to unify. They unify with each other, but they don't unify so completely that they disappear. They unify and they combine and they separate and they move back and forth. They have this beautiful dance back and forth together. That's a core idea, an idea you're very familiar with. And that's why if one of the pairs is deficient, the other one shows some symptoms. However, here's the most core concept that sometimes doesn't get presented so much in the Western literature because it's in more the advanced TCM textbooks on endocrinology, is that when you talk about 小克, wasting and thirsting, diabetes is one manifestation of that larger category. Then you have this, that the yin breaks in pao, and it cannot combine. Bu bing. That's what that says in the Chinese textbooks. The yin breaks. So notice now my little yin yang symbol has a little hole in it, a hole at the top and a hole at the bottom, that it no longer can hold together, right? That's a core idea. This is really central, very central. And perhaps you haven't seen this before. Maybe you have, but perhaps you haven't. But this is going to inform a lot of what we talk about today of how we treat this, because this is going to lead to a very specific way that the pathology presents itself. This way. Oh, there it is. Oh. Well, when this breaks, notice my little arrows, my red and blue arrows, that in the previous slides were driving or expressing the force that connects the yin and yang, that binds them together, called bing he, right? This combining and unifying force that drives them together because of the fundamental problem that the yin breaks, meaning the connective structure breaks. Then those forces no longer hold together. They unravel, and the yang goes up and the yin goes down. But this is not simply yin deficiency and empty heat. It's not. Why? Because as they separate, this is what creates the downward drive, which is it drains the yin out. That's why we call this wasting. The word shao in shaoke means wasting, which means that the diabetic actually gets skinnier. They get thinner. They waste away, draining out with their urine and stools, and everything that comes out wastes away their fundamental yin. The very power that could hold their body together starts to waste away and drain away. That's this downward going blue arrow. And the upward going red arrow is the thirsting. The thirsting means that there is an upward rise, a rise that goes up that starts to affect the body and mean that it has this attendant yang that's no longer tethered, no longer tied to yin, that starts to confound every system. And as it does that, you're thirsty, and the thirst is unstoppable, unquenchable. You have this thirst. Now, when we say thirst, that k means to be thirsty, to be hungry, to be ravenous, which is to want to eat, want to eat, want to have, and you can never get satisfied. And this is in Western medicine, they often say, oh, diabetes is starvation in the face of abundance. That's a Western medical rubric, that the person can eat and eat and eat, but their tissues can't absorb the nutrient, can't absorb the sugar, and they can basically starve to death in the midst of being able to have enough food. Well, we look at it like this, and if those two arrows, one went up and one went down, as you see in the little diagram there, they would unwrap the yin yang symbol so that it became a straight line. And the straight line would be still. It would be inert. It would be dead. Okay, if you understand that, then you have understood the fundamental idea in treating all of Xiaoke. Now, there's a lot more to it. This is just the fundamental idea. However, if you don't understand this, then you will be confused at every turn as to why we can't just treat it as, oh, just nurse the yin, just nurse the yin. That's not what fixes someone who has diabetes. Simply nourishing the yin doesn't solve the problem. Simply clearing the empty heat doesn't solve the problem. They mitigate the problem, make it a little better. They don't solve the problem. So we've got to get into more complex ways to solve the problem, and ways that ultimately we have special needle technique, special ways we do things with herbs, things that we can do to try to fix this primary issue, the issue of this fundamental crack that goes on here. That's the core. So just to recap that before we go on to the next part, normally the yin and yang pull together. Normally you see this attractive force between them. You have this primary insult to the system, a break, a crack. How do you get there? We'll talk about that in just a minute. And once that happens, yin starts leaking down, you start wasting, yang starts pushing up, you start thirsting, and eventually that will unravel or unknit the system and you die. So we want to avoid that. We want to pull that back together. Okay, so now before I go into the types, so Jonathan, if there's any questions now that people have on this basic idea, let's clear that up now, because this is really core to us understanding the rest of it.
So everyone, I know that a lot of you have been taught that diabetes and Xiaoke is related to concepts such as yin deficiency. And here is presented a slightly different view. If you would like to ask something about the difference, now is the time before we progress. All right,
Either people are stunned into silence or it's perfectly clear. One or the other. Maybe both. You never know. All right. So yes, as Jonathan pointed out, the simple idea of yin shu, yin deficiency, and shu er, the empty heat, that's not what we're seeing here. We're seeing here yin pao. Yin pao means yin is broken, yin is cracked. If I have my little teacup here, if my teacup is cracked, that's different than if it's empty. Right? That's what we're talking about here. And that's why simple tonification doesn't always work right. That doesn't work right for someone who's diabetic. That's the core idea. That's why it's a more involved pathology. And that's why it's called Xiaoke Bing. Bing means disease. It has its own type of category and it's conjoined patterns. All right, so now we start talking about how it's formed, and we're going to get into what to do to it. All right. Now, as you probably already are familiar with if you've gone through your TCM education, this is a fundamental taxonomy or division of how we view wasting and thirsting syndrome, Xiaoke. 3 types: upper burner, middle burner, lower burner. So it's 3 types. So the upper burner can have this process occur to it. The middle burner could have that same process occur to it, or the lower burner could have this process occur to it. And so it can crack or break in one of the 3. Now, it will progress to get much worse. It is important to determine which was the one that started it, because that's the first crack in the building, the first crack in the metabolism. So it's very useful to find out what that is. Okay. And the classic signs are, oh, upper burner, you're most thirsty. That's the thirsting part makes you really thirsty. The middle one makes you very hungry, and the lower one makes you urinate a lot. Well, eventually, any one of them poisons the other and will make all three symptoms. But finding the first step where it started is really important because that's the first place where the pot cracked or the first place where the knot was untied. That's the first place where everything starts and starts to unravel and unknot this. Okay. Now, so far so good. Pretty simple, right? We're going to have to say, what do we do to it though? Right? But develops from two different roots, two different parts. One is constitutionally. You have a problem in your yin, in the yang, in the yin. You have a problem in it. And that first problem, if it's constitutional, that's often what we would see in Shaoko where we see diabetes type 1. And if it's a constitutional weakness, that's the hardest one to treat and requires the longest term remediation. Okay, but that's one possibility, right? The other one is the more common one. You deplete the yin and you crack the yin from the lifestyle. But this doesn't mean, oh, I stayed up late one night. Oh, I had to get ready for a test. Oh, I had a lot of patience and then I went out with my friends and I was tired and I taxed my yin. All of that can be recovered. It is something fundamental that you break the yin and cross into this aspect of wasting and thirsting, how you break that foundation and you go into it. So it is a level of extent, frequency, severity, things you're already familiar with. So far, so far. Okay. Now, when we look at this, we're going to look at the patterns here, talk a little bit about herbs, talk a little bit about acupuncture, talk a little bit about some breathing practices and other remediative practices of what we can do to fix it. Okay, some things hopefully of techniques that you haven't seen yet. All right, but here's just a pattern. In the upper burner one is a lung heat with injury to fluids. Now, how do you get the lung heat? This ultimately is you cracked the ability of the upper burner to hold the yin of the lung. And as such, then the manifestation looks like lung heat and the fluids are consumed. So if I go back for a minute, this little diagram, this is happening in the upper burner. And this crack, if I want to call it that, or this break, occurred regarding the lung. Well, how do you get that? Smoke. You could be smoking. You could be doing things that dry the upper burner, a lot of alcohol. You could be doing other things that tax that. You could, based on where you live and the exercise you do, how you are consumptive of the yin of the lung, right? It can also be something where you're using any type of cocaine or crack or anything that is aromatically brought up because it can damage the lung, or depending on disease. All these are possibilities, or depending on your work schedule and your work environment, how drying it is. But it's not just dry once. It's got to go enough times that it cracks that yin. Once that happens, we're going to see the thirsting part coming up looking like heat, and we're going to see this wasting part draining away the fluids. Okay, that's what we're going to see here. So, of course, excessive thirst, right? A high fluid intake. You drink a lot, but you have a dry mouth. Okay. Eventually, accompanied by frequent urination and excessive hunger, eventually the lower and middle will start showing problems too. Simple. Tongue's dry, red tip, thin yellow coat on the tongue. All signs of heat, dry and sure. Pulse is rapid. We've got to clear the heat, moisten the lung, generate the fluids, nourish in. That's the standard treatment principle, but that doesn't fix the problem and get rid of it. That remediates the problem. So nourishing the yin remediates the problem, but we're going to talk about what comes out of the more cutting edge way that we fix the problem. So we're going to do that in just a second. Okay. Now, so far so good. This should all be very clear. This is the modern Chinese formula called Shaokefang, which is directed for this, which has the ingredients listed here: Huanglian, Tenhuafen, Shengdi, Ouzhi, Renru, Jiangzhi, and Feng Mi. Now, if you do Chinese herbs, you would be familiar with many of these. You might not know Renru. Renru is literally mother's milk. That is breast milk. Now, we don't really use that so much in the West. They use that actually in China. That's an ingredient they put into this formula. But you can use formula, meaning baby formula. Now, we're going to talk about this for a minute and take a little detour on this. Okay? All right. So someone put in there a question, how many grams? All right. So I'm going to come back to that in a minute, how many grams, because that's a discussion and it's a discussion we're going to touch on today, but it's a discussion that over the next 10 weeks. We're going to talk about dosing because the dosages get adjusted based on specific presentations. And so therefore the amount of Huang Nin, whether it's 6 grams, 9 grams, if we're talking raw or we're talking powder, but we're talking raw, how many grams gets modulated by how they're showing in a sub-presentation from this. That's a great question, but not an easy answer. Right? So right now we'll talk just a couple of these things about ingredients and then chew it up a little bit and break it down. So first, when we look at this, right, these herbs, Huang Nin's Huang Nin is cooling heat, right? It cools heat. Also, Huang Nin has endogenous berberine. Berberine is a glucophage. Glucophage means it moves the sugar into the cells. So it has both a Western observable function that relates that, as well as an Eastern function of helping to clear the heat. You have Tenwafan, which is lubricating and cooling lung heat and lubricates. You also have Shengdi, right? Shengdi, which of course nourishes the blood in the yin, strengthens the lower burner. You have Ozhi, right? Again, helping in terms of the digestion in the yin. You have Zhangzhi. I'm jumping over the Renru for a minute, right? And so Zhangzhi and Fengmi, addressing kidney, and Fengmi, addressing spleen. But Renru, this one is very interesting because this is, as I mentioned, mother's milk. But here, we're going to take a detour from this for a moment and talk. If with your patients who have upper burner sited Shaoke, they have an upper burner part, the upper burner component to it, those people use formula, baby formula. The baby formula, the formula that's used as opposed to mother's milk, use the baby formula that these people, that you give to these people, baby formula like you get at the store, and have them take approximately, let's see, well, I'm used to ounces. So, Jonathan, you got to convert 6 ounces into milliliters because I'm not so good at that. All right. So, but about 6 ounces a day of baby formula. That has an enormous impact on helping them in terms of their maintenance and that beginning of the repair of what's going on with that crack to the yin, especially in the upper, because it's considered to be, from the TCM perspective, generated from the mother's upper burner. Right? That's why it has this force to regenerate the upper burner. So about 170, even if you went a little higher, 180 grams a day of that would be fine. But a day, every day, regularly.
And Doc, we gotta mention this is a standard dosage for a 140-pound person.
Correct. Someone who's about 140 pounds, that's what we'd be at. 140 pounds is how many kilograms? Let's say.
63 kilograms.
About 63. So roughly if you were, 62 to 64 kilograms, you'd be taking approximately, the 170 to 180 milliliters of the formula a day. Okay. So it's a simple thing to do. It doesn't necessarily.
Doc, just to be clear here, milliliters or grams?
Grams.
Grams.
Well, here's the thing. If you get formula, it's a liquid. Baby formula is a liquid. Right? So you have to have it in liquid form. Right?
But you purchase it as a powder and make a liquid out of it.
Either way, depending. If you can get it as a powder, otherwise they sell it here, at least in the United States, in bottles and liquid pre-made. So either way, but it would be that amount. But so yes, so it could either be in a pre-made liquid or it could be in a powder that you'd want the derivative of. Okay. What is baby? Someone said, what is baby formula? In the chat.
Maybe she's not familiar with the English term.
Yes.
So just said it in Hebrew.
Yes, of course. I mean, yeah. Maybe you don't use a lot of baby formula in Israel. I don't know. That I'm not sure of. Okay. They don't use a lot of it in China. That's why they use mother's milk in this formula. This is a modern Chinese formula. It uses true mother's milk.
Doc, where it says ginger, here it refers to ginger juice?
Yes, ginger juice. The pressed ginger juice.
Okay.
Yes, the pressed ginger juice. Right. So ginger that's been pressed out, which of course is helping the yang, right? It helps the yang of the lower burner in many ways. So this is also
Ujir, I don't think is very common in the pharmacopoeia. Which one is that?
So odor is not common, so common in the formula. It's a juice. It's a pressed aspect out of the ginger plant. But I want us to focus today, at least, heavily on the Renru, and we can draw this diagrams. Let me see. Where's my diagram? Hold on one second. I got to exit this for a second. I have, hopefully, I have it open already. A diagram because we could. That's not the right one. Where is that other diagram? We could spend a lot of time talking about the analysis of these formulas. But I, again, don't want to go too heavy into that right now. Here, we'll pull this up just for illustrative purposes. There it is. Boom. Right. So here, hopefully that came up clearly. I got to enlarge it so you guys could see it. There we go. And then move over so you're actually on the, where is it? How come that did that? Oh, give me a second. That's weird. Me and technology sometimes get along, sometimes we fight each other. I apologize for that. There it is. Okay. Now let's bring that up. There we go. And a little bigger. There we go. Okay, so here we go. All right. So this is a structural analysis of this formula, right? That addressing the yin is the shangdi huang, addressing the yin deficiency empty heat part, which is the less fluid and the dryness, is the tenwafen, which targets the lung, and the odor targeting the heart, right? This
Doc,
is
please make it slightly larger. It's difficult for us at
even
home
bigger.
to view.
Okay. Is that okay?
Yeah, that should work.
That didn't work. I just messed it up by, let's see. Sorry about that. There it is, centered, a little bigger. How's that? Then you can see the upper part, but there's only one part of the formula.
That's perfect.
Okay. So here, okay, this formula, we can break down how it addresses the upper burner. It's got Huang Nian, which shows the inflammation. It's got the Tenwafen, targeting lung, the odor, targeting the heart. It's got the Shangdi Huang, targeting the yin part here in the upper. Then the Feng Mi drains down. That's a honey, and it drains down. The Zhangzhi goes up, so it stabilizes the middle. And then coming down here, you got the Renru, which strengthens the source qi, the kidney, and the foundation. And it is, of course, produced by the breast and the upper body, so it helps to stabilize the yin specifically in the upper body. That's a structural analysis of how the formula works. And if you look at this formula, even if you don't do so much of Chinese herbs, you will notice that if you look at the picture, forget what the words say, but you look at the picture, the onus of the operation of this formula is in the upper part of the body. And that's where the problem is. The problem lies in the upper part of the body. So this is targeting heart and lung and the attendant rising aspect and the yin consolidating aspect, and it pulls it together. That's this modern formula, which is called Shaokefang. But what I want you to take from this formula, you can actually get this formula produced commercially. They make it, they ship it. You can get it from Tongrang Tang. You can get it from ActiveHerb, or I'm not sure what other suppliers. Actually, Jonathan, you have a connection with one of the herb suppliers there in Israel. So perhaps they could also bring this formula or make this formula into a commercially available format. All right. So, but this formula, what I want you to take away from it, because we can spend a long time on formula dynamics and how formulas are created. But here, if you look at it, it's like an upside down triangle. It's an upside down triangle with the emphasis on the upper burner. That's why it addresses the upper burner chakra. Now, again, if you don't do a lot of herbs, this is kind of technical on that. So as we go on our other 10 weeks, then we'll chew on these a little more as to the structure. But someone asked before about dose. Depending on what is the bigger issue, depends on how you're going to shape the dose. If there's a lot more of the heat signs, you have more Huang Lian in the formula. There's a lot more of the dry signs, you target the Tenwa Fun at a higher dose. If there's a lot more anxiety, discomfort, difficulty with the heart, you target the Ojer to a higher dose. If there's a lot more of, you see the yin, the fluid, the foundation, then the Shengdi gets a higher dose. If things don't swallow and drain down, Feng Mi goes up in dose. If they're fatigued, kind of worn out all the time, then maybe the Zhangzhi has to come up a little bit. And if their fundamental ability to regenerate is impacted, then the Renru, or the baby formula, has to go up in that dose. Okay, that's why the doses have to be modulated. Okay, all right, but let's talk also on this upper burner one. I'm going to switch our screen share so we go back to our, right there. There we go. We go back to where we were. All right, so, and we're talking about this upper burner dynamic. Okay. Right.
Doc, so just so everybody could follow, so Ujer is the juice produced by squeezing the stalks of the ginger plant?
Yes, the stalks and flowers, the top part.
The stalks and flowers?
Yes, the top part.
Okay, and Jiangzhi is the juice from the rhizome.
Right. Ojer also is sometimes created. Ojer can also be created by squeezing lotus. That's another version of it. There's more than one version of it.
How do we decide which one is best to
Well,
use
this
here?
is this is what I'm trying not to get into today because we don't have 6 hours. Right. So what I want you to take away from this, because unfortunately we got 2 hours today, and we got to get to the needle technique and the breathing technique. But what I want you to take from this formula, which is used in China as a standard for the treatment of upper burner Shaoke, is the Renru idea, because you can get baby formula. You can get that, and you can use that with your patient if you're an herbalist or not, as opposed to going into the complexities of this formula. All right. And those who are herbalists, who are skilled herbalists, can look at this formula and modify dose and go with it. Or if they come for the rest of our 10 weeks, we're going to go through it in very, very, very big detail of how to modify and switch this out as using this as a foundation. So I'm going to dodge that question just because of time, and I want everyone to go home with stuff they can use. So first thing you can use out of this is this Renru concept formula or mother's milk taken out of that. Okay? Does that make sense? We can live with that? It's the best answer I can give you in the time that we got. Fair enough?
Certainly. One little thing that I want to ask is fengmi, which is honey.
Yes.
I would guess that some patients would say, honey, like you put honey in my formula, like I'm diabetic, I can't have honey.
Well, 一度制度, yeah? Using toxin to treat toxin. That's a fundamental idea in Chinese medicine. You use a small amount of honey as an envoy because it's sugar and it goes to the problem with the sugar. We're not talking spoonfuls of honey, small amount of honey, right? Helps to keep this draining down. Honey goes downwards. Also, interestingly enough, diabetics do better with a honey than they would with some commercially produced sugar, right? So it's a small amount of honey. But yes, it's an interesting observation. But sometimes we use that. Sometimes you use a hot condition, gets a small amount of hot herb in an overall cold formula to balance it out. So it's use a small amount of that honey, right, as an envoy to address that. But yes, it's an interesting concern. But and at first look, surprising. All right, so far. We're going to move back to this, and let's talk more now about acupuncture. Because many of you, I think all of you, probably do acupuncture in addition to your herbal medicine if you do herbs. All right, acupuncture. In terms of acupuncture, for all of these, there's one technique that I don't think, I could be wrong, but I don't think you have probably been exposed to. Right? This is called Bing He Fa. Bing He Fa. This is a technique to recombine the yin and yang, because we go up and we talk about this yin and yang failure to combine, right? This is yin yang bu bing, right? Bu bing he. Bing is to connect, combine, and he is to unify. So this is the root of all the Shaoke is the yin and yang fail to combine. There is a traditional classical needle technique that's used for this problem. It is an advanced needle technique, but we're going to go over it right now. You're going to learn it. You're going to go home with it. You're going to put it in practice. So when the person comes in who has upper, middle, or lower, you're going to know this technique to do it on them. Okay? Now, this technique, and I have my little pen that is representing a needle, because if I hold up a needle, you can't see it with the camera, but my little pen goes and it goes into the point. So you insert the needle. That's the easy part. I know you're going to ask where, just hold on, right? Insert the needle. You're going to get Qi. You're going to turn the needle until the needle binds and catches. So it has to be a little Qi. You got to turn it on. Got to get that needle going up a little bit. Okay. And then with this, you're going to grip the needle down low, not up at the very tip of the handle, down low, closer to the skin. You don't have to touch the skin, but closer to the skin. You're going to take the tip of the needle and you're going to push it around like you're making a circle. Now, my pen can move freely in a circle. The needle cannot move freely in a circle. We know that. Historically, it's described as if the tip of the needle turns a circle. Okay, that's historically. Now, we know that doesn't do it, but by turning the needle, you're putting pressure on the sides of the tissue. You're putting pressure on the sides of where the needle's inserted. So you're going to turn like you're making a clockwise circle. You're going to curve as if you went through the middle of the needle with the curve of the yin-yang symbol and turn a counterclockwise circle. You're going to come up halfway up to the skin, down a little bit below the level of the point, and back to the middle, and you're going to Qi in the center. Okay, you're redrawing this symbol. That's called being He Fa. Let's go over it again. It's very straightforward, right? It's not that complicated. It's very straightforward. So I have this heavy needle sitting here for illustrative. Maybe you guys can see that one, right? So if I put the needle in, it would go in the skin. I then would turn the needle clockwise by choking up and turn it clockwise as if I'm drawing inside the body, like I'm drawing a circle. I would curve as if I drew the yin-yang symbol and therefore make a counterclockwise circle. I would rise up a little bit, representing the yang that's trying to get away, and go down a little bit, representing the yin that's trying to get away, and pull back to the middle and Qi. I'm going to draw a diagram of this. Okay, so we have a diagram of this. What we're going to draw it together. Okay, all right. So being He Fa. Right now, let's see. Oh, we got to stop the screen share for a second so I can get my paint function going. All right. And give me 1 second. Okay. There we are. All right. So now let me share this so you guys can see what I'm looking at. That's often useful too. Okay. Here we go. Now, here's my screen. Now you can see that. If here is the level of the skin, let me make that line a little thinner, but that's the skin, and I'll drop that down to here. So that represents the skin, right? So we're coming into this point, and then we're going to take the needle, right? And so I'm going to drop my needle down. There's my needle, okay? All right, so now I'll put a little handle on my needle. Okay, so everyone's clear on that? That's the easy part. That's the easiest part of them all, right? Needle goes in. So step 1, insert. I'm going to label it for us, and I'll send Jonathan this picture, and he can give it to you along with the sets of the slides that we do, as well as the recording for anybody who's come, and they can all look at this, okay? So this would be, first of all, this is Ping He Fa, right? Ping He Fa, right? Let me switch over to Chinese. Bing, where's my Bing? Bing, wrong Bing. Bing, combined Bing. Where's my combined Bing? I'll annotate the Chinese later. Oh, there it is. Bing, He Fa. There, that's the characters for it. All right, so Bing He Fa, right? This is the thing. And then the first thing is step 1, insert, and Qi. Insert and get the Qi, right? The Qi. So you get the Qi response. That's step 1. Okay, I'm just going to move this over a little bit. I'm going to move down. There we go. Okay, so far, so far. Now, I'm going to take this. We're going to copy this and do this in a stepwise format. Okay, so our next step with this is with the needle, we are going to take the needle and we're going to trace with the needle. This is one needle, but I'm drawing this so you can tell how it's tracing. All right. Okay, you're going to trace a circle, a clockwise circle with the base of the needle. Okay, so by rotating the needle, you're going to trace a clockwise circle, and I will put a little arrow on here so we can see that we've gone in a circle. Right, tracing around like that. Okay, good. All right, so far so good. Right, retweet. This is step part 2. Right, so we annotate this, and we go 2. Oops, that's a line. We don't need a line. We need the text. There we go. 2. Trace a clockwise circle with the tip of the needle internally. Okay, so far so good.
Doc, the arrow looks counterclockwise when we look at it, so maybe it just reverses in the image?
Sure. You are asking a lot out of me. Oh, I could flip this one.
No, that's fine. We don't have to flip it.
Yeah.
I just know that, it accidentally came out the other way.
How's that?
All right, perfect.
So just put it like that. There it is. And I will simply get rid of that little black nubbin. Okay, now we're happy. Now we're good. Yes? Okay, turn to clockwise circle. Now, so that's well, I can't even spell though. I wrote "ta" over here, so we'll fix that too. All right. Sorry about that. If I spelled correctly, that would be a little easier to follow. But that's how you can edit in Paint. There we go. Tip of the needle. Now, the next one, I don't have to draw as much of a diagram. I just have to take this diagram and fiddle with it a little bit, because then we're going to take actually we'll take this one, right? And we're going to trace through the center. We can take this one, it's fine. All right. Step 3. And now we've gone clockwise. We have to go through the center of the diagram that we're drawing, the center of the circle that we're drawing here. Oops. And we trace through the center. Tracing through the center, making it look like a yin-yang symbol, right? So that's step 3, trace through the center. Right, so trace the needle through the center. So step 3. Okay, so far so good. Okay, then step 4. Step 4 is almost identical to step 2, but we're going to be tracing the opposite way. Here. Trace the circle counterclockwise. Okay, so we trace clockwise through the middle, counterclockwise. Then 5 would be going back through the middle. 5 is identical to 3. So I have to move over a little bit from my picture and move up. And I should just reverse that. Okay, step 5. Trace line through the center of the circle like a yin-yang symbol. Okay, that's 5. Only 2 more steps and we're all done with it. Okay, so then we have to come up and down. So I'm going to switch over to this little diagram over here. Still take number 1 again because we're not going to have the spiral anymore. So we take this for 6 and 7. Okay, so here we then trace up. Right, so we're going to trace upwards from the center, up. Oh, that did not do what I wanted to do. Sorry about that. Okay. We go center tracing up. Okay. So we go from the center up and then back down. Right. So that's this part. And then I'm going to click again. I'll label these in just a minute. So from the up, we then go down. Because we went up, then we go down. And the last part, we come back to the middle and Da Qi. Oh, sorry, wrong line. There we go. Right to there. And we Da Qi. Okay, so now labeling these, this was 5, 6, 6. Draw the needle up to engage the yang. 7. Drive the needle down to bring down the yang and seek the yin. And last, 8. Draw the combined yin and yang together to the center point and Da Qi. All right, there we go. That's all
Now,
8
which
steps.
points do we use it?
I'm getting there. First, let's go over how you do it again, and then we'll go over how you do it, where you do it, because it depends on which pattern. But now this technique, Bing He Fa, that we just talked about, right? This technique, which is it's combining and unifying, right? Combining and unifying, method of combining and unifying. That's what this means, right? This is the method. This is combining and unifying method, needle technique, needle method. Okay, this is one classical needle technique. It's used specifically to do this when the yin and yang separate. It's also used for yin and yang collapse. So if someone's having a bad situation they could die from, you could do it. First, insert in Da Qi, right? So we get the Da Qi at the spot. I will put also just a little circle here to imply that the Da Qi, you get the Da Qi here. You get that to turn on, okay? Insert in Da Qi. 2, right? Second, you trace a clockwise circle with the tip of the needle internally as if you're turning the needle. We know the needle doesn't really turn that far, but you're pushing against the tissue, making a clockwise circle. 3, trace a center line as if you're making a yin-yang symbol, and that reverses the direction of your circle, and you trace a counterclockwise circle. Then, then you trace the center line of the circle, again like a yin-yang symbol, going the other way. Right? And then you draw up to engage the yang. You draw down to drive the yang back down to the yin and combine them, seek the yin. And then you draw up and Da Qi in that center spot. So you're re-knitting, you're sewing it back together, you're driving it back together with a very specific type of stimulation. So acupuncture is a technical discipline, meaning with techniques. You need to use techniques to change this. So now, this technique, which is a major classical technique for Shaoke, for wasting and thirsting, used for diabetes. Now you got that technique. I'm going to send you this diagram. I'll send it to Jonathan and send it to all of you. You can have that diagram, no problem. Diagram doesn't mean anything until we talk through it, until it makes sense. But now you got it. Now you're going to help your people with it. And now to that question, where? All right, before I leave this symbol, this picture, right, which I can zoom out and you can see all the pieces to it, you're going to get a diagram like that with all the pieces, all 8 steps. Any questions on this procedure before we talk about where to apply it? Okay, I'll take that as a okay. All right, so far so good. Oh, we have someone with a hand up. So Ron, if you have a question, please ask it. You could put your mic on if you need, or if you need Jonathan to help you with translating, that's fine too.
ערן, אתה הצבעת? אתה רוצה לדבר? אתה יכול לדבר גם בעברית, אני אתרגם?
Gotta put the mic on.
Yes, after you finish all this technique, do you leave the needle in for how long, or if at all?
Great question. So 2 answers, 2 parts to the answer. It's a great question. One is if they are not very sick, if it's pretty healthy, then you do the technique, done. The more sick, the longer you leave it. If you leave it, right, this is often retained traditionally it's retained on a water clock. Now a water clock, the Chinese water clock, one full rotation of water clock is 25 1/4 minutes on our clock. So about 26 minutes. That's one full rotation where you'd watch the water clock, and the water clock would have the water seeping going back and forth. Traditionally, this is kept usually a half of the water clock, which is about 13 and 1/4 minutes. So about 15 minutes. 15 minutes is fine. But if you're going to do it 15 minutes, usually this is stimulated in even numbers if you're going to retain it. So you do it once, halfway through, do it again, 2 times, or do it 4 times. Stimulate once, maybe 5 minutes, stimulate again, maybe 5 minutes later, 10 minutes, stimulate again, maybe at the end, stimulate again, 4 times. Usually it's stimulated in even numbers, not odd numbers, not 3, not 5. So usually just by itself alone is okay, or 2 times, 4 times, 6 times, 8 times, even numbers, because even numbers are considered to strengthen yin and odd numbers considered to strengthen yang. Okay, so that's a great question. Good. All right. Other questions?
Would you say 15 minutes is the upper limit for somebody who is very sick?
No, if you're very sick, the upper limit is 1 full rotation of the water clock, which is 25 and 1/4 minutes, which is about 30 minutes. 25 and 1/4 is exactly what a water clock half hour is. But realistically, it's easier on our clocks just to say, okay, 25 minutes, 30 minutes. So the upper limit, I'd say, would be 30 minutes if they're very bad. Okay. All right. Good. Ron, still another question, or do you have to take your little hand down? There we go. Okay. All right. So great. So now let's go back and say where we're going to use it. And that we have to go back to our other slides, okay, and talk about where we're going to use it. So here, this first one that we were looking at is upper burner, right? The upper burner. Whoops, there we go. Upper burner. So if it's the upper burner, and we know that this affects the upper burner, we can use this technique, the Bing He Fa technique, on bladder 13, back shu point for the lung, bladder 15, back shu point for the heart, right? Or Ren 17. Now Ren 17 is very shallow. You have to go a little angle. You can't go deep. It doesn't have to be a deep technique. It has to be the shape of the technique. So it can be a very small range. You can be moving that needle in a very small amount back and forth. So if, hopefully one day, COVID quiets down, and then we could take a trip to China and go watch the experts, you'll see these experts work the needle, and if you ask them, what did you do? They go, oh, nothing. Nothing? They go, yeah, nothing. And then you notice, and they use a heavier needle on some points and a lighter needle, a thinner needle on other points. And you go, use different needles. Why? And they go, oh, no reason. No reason. You have to get to know them a little bit. Maybe come and observe again and again. Maybe go to have tea or food with them. And then you say, doctor, I wanted to practice that technique for the diabetes patient, and I don't know how to move the needle. And then when they're relaxed, they say, oh, no, you have to do this. And they show the technique, because they don't show it when they're working quickly with the patients and some observers come, because they don't want to get in a big conversation and have the patient be, how come I got that and he didn't get that? Am I really sick? And you all work in the clinic. You got to get your schedule done, right? So many times you look and the better clinicians use fewer needles, or they use different size needles on different points in the body, or they work one point. And when you ask them, they go, oh, 就导气啊, it was just getting the qi. Just the qi? Then later they're like, oh, 这是符法. That is a talisman technique, a technique with a symbol. And Bing He Fa. And then you get in the conversation with them. Okay? So it is oftentimes knowing when to ask the question, when not to ask the question, hang around with them. The clinicians have to get used to them. If I came to watch your clinic and you had a special technique and I asked about that technique and you were very busy, you wouldn't want to answer me at that moment. You would just say, oh, it's getting the qi, and you'd go on. When the day is not so busy, afterwards, then you can get that. And so one day, when COVID's done and we could take a trip together to China and go visit the university there that we have relationships with, then we can watch the doctors, and then after, when their shift is done, we talk to them and get some more of the technique. Okay, you always add more technique. So hopefully this technique is clear. So first, upper burner. Where do we do this? Oh, we can do this in the bladder 13, bladder 15, back shoe point for lung, back shoe point for heart. We can do this on Ren 17. We could do this on lung 1. We could do this on Ren 14. Those are major areas to affect the upper burner to work that technique. Okay, so far so good. Now, that's not the whole treatment. Inevitably, that treatment would have to be one part of a whole treatment where you're addressing their other concerns, because no one is just one pattern. But there's a part of that. All right, let's keep moving, all right? Also, while we're working on this here for upper burner, we're going to add 2 things. One, food, simple, apricots. Apricots work really well. They're simple, they're easy to get, they move the lung qi, right? The apricot is a really strong one for helping as a simple food additive for someone with upper burner Shauka. Okay. One other thing, I'm only going to give one food. But what about foods? Yes, if we do the rest of the 10 weeks, if you come hang out and we go do all that, then yes, we're going to go through diet and detail and whatnot. But again, today we only have 2 hours. So today we're going to go things you can use, some suggestions, some simple things. Fine. One other thing, that's before we go on to the middle burner presentation, okay, is Qigong. Now, you may have had Qigong and done Qigong, and maybe you like Qigong, maybe you hate Qigong, maybe you don't want to do it, maybe you send a patient to Qigong class, I don't know. But I'm talking specifically about something that helps to recombine the yin and yang like we talked about here. So we're going to do this. It's very simple, but what's easily learned is easily forgotten. That's true for us. That's true for the patient. Okay, real simple.
Now, before we start the Qigong, just 1 second. Marina had a question regarding the size of the needles which should be used for various points you mentioned.
Okay, so generally speaking, if we're talking Chinese style acupuncture, then we're using the size that the common work size is a 0.3. I'm going to put this in the chat. The common work size needle is 0.3 millimeters by 30 millimeters. That's the most common working needle. That's oftentimes we go up from there and we go 0.3 millimeters times 40 millimeters for someone who's bigger. But those are the common kind of working needles. I put it in the chat. Working needles mean what they do the work with every day. Now, your patient could be very sensitive. You can go a little smaller. If you're at Ren 17, maybe you go a little smaller. But do not use the ones for ear. The ear needles, they'll bend. They bend too much. So if it Ren 17 in the chest, right, because you can't go so deep, angle a little bit down. We can barely see that little needle because of my shirt, right? But angle. So you angle down. That's okay to angle and still do that symbol. Okay? So in that sense, but on the back, we're really talking about you do not have to go deep, but you need a needle that is thick enough to turn and not get a bend. You bend a needle, it has to be flexible and strong so you can do all that tracing back and forth. Okay, so my suggestion to get used to doing that technique, the Bing He Fa, is take a piece of chicken, a little bit of chicken from the supermarket, and put the needle into the chicken a little bit and trace this back and forth. Do it on the chicken. We call that, or I call that, the poor person's cadaver lab. right? So it could be chicken, could be beef, could be whatever you have, right? But fish doesn't work well. But aside from that, it works really well. And that way you can practice. Now, you could still eat the chicken. It's still okay. It's a sterile needle. You're fine, right? So, okay. All right, but that's a good way to practice. If you, just in general, needle technique, practice on chicken. Chicken with the skin, getting used to going under the skin. Chicken without the skin. Needle into the chicken and then cut the chicken away and look at it. See what it looks like. It's not exactly like a person, but it's good practice. And it's different than practicing on wadded up paper or on something that's not organic. Okay. All right. Good. So far, so far. All right. So now let's go to this straightforward and pretty simple Qigong idea that we're going to introduce that you're going to give to your patients. Okay. So here, and this is the symbol, this is the image that we have about how the yin and yang are separating. So we're going to breathe in what's known as a Wu breath. Wu, W-U, is a Chinese word for dynamic or martial. And that's very yang. And that's basically breathing hard. Open the eyes wide, open the ears, open the nose, expand the body, breathe strong. That's the Wu. Okay. Then we're going to have to alternate to do what's called the Wen, W-E-N. Wen means cultivating breath, which is your eyes, ears, nose, mouth, skin, all pretend to look inside. What does that mean? And you breathe quiet, as if you relax in. That's the yin breath, the Wen breath, cultivating, versus the yang breath, the Wu breath, the expansive breath, right? So this is known as the Wen and the Wu. So the Wu breath is the yang, right? Equals the yang, and the Wen, W-E-N, equals the yin, right? Now they do have characters to them. They do have Chinese, they are Chinese words, right? And Wu is the, I don't think in my chat, I don't think I can switch my font to put that up there. Sorry about that. Okay. All right. Oh, did that come out? Oh, I got this. This is very strange. Okay. I put that up there, but it went only to waiting room participants. Sorry about that. This is what I had before.
As the professor is writing, I just would like to note that unlike other forms of Qigong, maybe some stuff we've been exposed to in Chinese medicine school, here we're speaking about something which can change the pulse and the patient's blood sugar in minutes. So this is not something you have to specialize in. You don't have to be a Qigong teacher to teach it to a patient. The patient doesn't have to practice it for months or years to get results. This is literally immediate. This is why the professor is teaching it right now.
Exactly. This is very, very, very quick. Now, the slow self-cultivation, many years practice, wonderful, thumbs up. But your patient is impatient. The patient wants it today, right? So this is very specific Qigong medicine, as opposed to the long, slow cultivation. Okay, so right, so if we go again, here's how we do this technique. So we're going to breathe forcefully, the Wu, and then sink it down, and breathe softly. As if you're looking inside, and then squeeze as if you are squeezing together. But for this, for upper burner, you want to squeeze here at Ren 17 and go like you're pushed in, like it, and you want to make a sound. You want to like you squeezed it, and it will link the yin and the yang. All right. If you do it right, you should feel a little when you do it, and if you do it right, you feel a little bit more awake. Okay. As Jonathan indicated, if you do this every day, 3 minutes, 3 times a day, morning, afternoon, evening, the next day, you'll see a change in the blood sugar numbers. Not perfect, but it goes down. You got to keep them doing it. They'll see that change. If you know how to take your pulse, if you're good with the pulse, you'll see the pulse change very quickly, very quickly. So if you did this with them for maybe 5 to 7 minutes, that sounds like a short time. 5 to 7 minutes of breathing alternatingly. 5 minutes is a long time, right? 5 minutes is a long time. So if you do that, you'll see their pulse change. Okay, so I think right there, Jonathan, there's a question that popped in the chat maybe.
Yes, how many breaths or for how long with each type?
So even numbers, because we're trying to generally build the yin. So in other words, 4, 6, 8, okay, back and forth, back and forth. Even numbers of repetition, 2, 4, 6, 8. You'll know it's too much because they get dizzy. And you might not get dizzy. Diabetic patients get dizzy real fast. They're like, whoa. So better to do less and have them do it frequently. It's easy if they do it, right? If they do it.
So we count the repetitions as in and out. That's one repetition, right?
Correct.
So we might do in and out, yang breathing, 10 repetitions, in and out.
10's too much. 10's too much. 10's too much. We're talking about 4, right? Like 1, 2, 3, 4. Okay. 1, 2, 3, 4. 1, 2, 3, 4. Okay. Does that make sense? You might say, 4? You're healthy, right? Old Mr. Johnson is not so healthy. And breathing forcefully 4 times is something he has not done in 25 years. So you'll be surprised sometimes how hard it is for people to breathe. Ironically, you go to the gymnasium, the gym, and exercise. There's lots of weights to pick up for your arms, for your legs, for your back. You don't really have weights for your diaphragm, for your rib cage to breathe. Not really. But that's more important than everything else, because if you don't breathe, you don't survive. Okay? Does that make sense? Now, Jonathan, there's another question I think that popped in the chat there.
So she asked whether you would recommend 7 minutes 3 times a day.
7 minutes, maybe at the most. That doesn't sound. After we're all done, spend 7 minutes doing the breathing, and you'll realize how long 7 minutes is. I would start most patients with, I'd say, oh, yeah, a minute, 2 minutes. Why? Judge, will they do it? If they will not do 2 minutes, they won't do 7. Right? So the old Chinese saying is the beginning heart lasts 3 days. 所心三日. For the beginning heart lasts only 3 days. Meaning you start something and for 3 days you're like, go, 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 go. And then you say, I can't do it. So try to get them to do something regularly. As you all know, treating diabetic patients, they're not good at maintaining their diet. They're not good at doing anything regular. So try to start with them slowly. But yes, ideally, 7 minutes 3 times a day would be great. I don't know how many of the patients will do that right away, but they will win the game with some frequency, not with one big training session. All right, so far so good. So we've got this Qigong idea. We've got the apricot for the person with the upper burner one. We've got the needle technique, and we've got the idea of introducing the mother's milk or the formula, right? The baby formula taken from that herbal formula as a method of some way to use some remediation like that. Okay, let's talk about the middle. Okay.
Just a moment, Doc.
Sure.
You mentioned something earlier which I found fascinating. You said that one can get to the point of the yin breaking down also as a result of an illness.
Yeah.
So would you be inclined to suggest that someone can become diabetic because of, say, an external pathogen, the long-term ramifications of an external pathogen?
Yes. Yes, the
It's
long-term ramifications of something that's not resolved well. So not that you get a cold, not that you get wind heat or something once, but you get something that lingers or you get sick again and again and again, especially something viral, something that's considered a hot pathogen that consumes the yin, can break the body, can lead to some long-term problem. So if someone had, emphysema, or someone had, or even possibly COVID, right? The byproduct of that afterwards, what has happened when the body's been damaged because of a long fight with disease, especially in the upper burner, a long fight with some disease in the nasopharyngeal tract, right? That can consume, we say true heat consumes the yin. It can consume the yin to where it damages and breaks it, right? So just like smoking, just like other type, like cocaine, that can dry and desiccate and break it. So a long-term infection, not treated correctly. I do know that there's a problem when people who have HIV, who are on, the cocktails, but they still have a suppressed or a weakened immune system. If they wind up getting some sort of viral pneumonia, that can go on for years, right? That person would be more ripe for other systems to be highly damaged by it. Okay, does that make sense?
yes. Are there diabetic patients for whom we should be looking after perhaps a lingering pathogen?
Well, you should be looking for, you should take a full history and you should look at that and remember lingering pathogenic factor theory. You look at the back of the tongue and the lumps on the back of the tongue. And if you're not familiar with that, we can talk about that when we do our extended course. But the short answer is yes. But you should always be looking for a lingering pathogen in an intake and say, is there something that's been going on that caused this that didn't heal and is a constant block to your metabolism operating correctly? Right? That's a great way to start, especially for the patient who seems to always be suffering from something. No matter how much things remediate, they're always suffering from something. Okay, great. And just as an aside, in Western medicine, there's Western medical research on diabetes that is showing different relationship to the vagus nerve, to other nerves that run down through the upper assembly, that's looking at potential viral infection of the nerve structure as a trigger. So this is not so weird or out there to say that maybe some sort of infectious pathogen will predispose you to go into diabetes, right? Okay. Now, also in the chat, there was a question. Dana had a question about at the end of the breathing, right? At the end, that at the end. Yes. All right. So technically, we'll go over it briefly, but technically, there is that technique in Qigong is called consolidation of the burner. And if you were to, if you would be playing tennis and you hit the ball, boom, you solidify your motion. Boom. That same solidity of the motion you try to do in this first technique at Ren 17, as if you take all the muscles around it and push, like you want to grip the middle of your chest. So, if you were to push a car out of, wait, I was gonna say a car out of the snow. You guys in Israel, you don't have snow. It's a terrible analogy. I don't know. You took the car and it got stuck in the sand, maybe at the beach. I don't know, maybe something like that. But you got to push a car. You don't push a car without putting your force down, usually to your lower belly, down below your navel. Or you push a door. That same push in the upper body. Now you've done that. Really? You have your arms full of packages and you get out of your car and you push the car with your elbow and you kind of shove it a bit to get the car door to close. Or you have food and you have a microwave oven and you're like, oh, and you kind of get your elbow on the door or the microwave and you have to hit it hard enough that it closes. You give it that little pow, that pow in here. But don't worry too much about it. Most important, soft breath, soft breath, soft breath. And a little like you squeezed the upper burner. So you're trying to stimulate the yang and pull it down, stimulate the yin, and then squeeze it, squeeze it, squeeze it. like a stapler. Put it back together. Okay? I guarantee you practice that for a week, you'll be an expert. It sounds complicated, but it's not. Okay? And
I think Marina is wondering whether this is similar to Fajin.
it is similar to Fajing, yes, but it's not going out. Because Fajing is out. This is going in. So yes, it's similar to Fajing. It is technically called Gu Sa Fa, which means to consolidate and stabilize. But it is a type of Fa Jing, because Fa means to produce, Jing means essence. So Fa Jing essence, producing outwards, gives you power like in martial arts. Producing inwards will link the yin and yang back together. That's why I said like a stapler. Okay, good, great question. All right, so you'll also find that your patients have various problems in different parts. Some can do the yang part real easily. Some can do the yin part real easily. Some can't do any of it easily. And some have a real hard time with this last consolidating step. Okay, great. All right, so now, middle burner. So talk about the middle burner, right? So here, if the middle burner is broken, and this problem that we saw here is occurring in the middle, right?
Just a second, Doc. One final question concerning the Qigong.
Mhm.
So Marina is asking, should they be doing this sitting down or standing up?
Well, either way, if you practice it, all of you, do it standing. When the diabetic patient does it, let them sit. Why? When it's standing, it's more intense. When it's sitting, it's easier. It's softer, right? So always start with softer. You can always get harder with them. If you start it too intensely, nobody likes to back up. So rather do it and then they go, oh, it's so easy. Great, let's do it this way and make it a little harder. Rather than, it's too hard, then they back up and then they feel bad about themselves. They feel like they're not enough. They don't get the best benefit. So always scale up. That's psychology more than anything else. It works both ways, right? But if they're slumped in a chair, really down with their back against the chair, very hard to do this technique. So even if they sit, they have to support their own body weight. Okay? All right, but that's a great question. Exactly. Again, my suggestion with a patient, don't be too specific. If you go to Qigong class or Kung Fu class, you're studying Kung Fu or Qigong or any of this stuff, the teacher will often be very exact. That's fine. You're a student. A patient doesn't want to do the exercise. They'll do the exercise because they need it. It's like medicine. They don't want to take the medicine, but they will because they need it. So my analogy to clinicians is that when you are treating somebody, it's like a potter's wheel where you have the clay and the wheel spins and you slowly shape the beautiful vase. It has to spin. So at first, it looks like a lump of clay, looks like a pile of dirt, wet dirt. And as it spins, you start to shape it. It looks a little better, still ugly. You shape it more, still ugly. You shape it more. It takes a long time till you shape it to something beautiful. That's how you work with the patient. And whatever they do, you say, that's great. That's great. Well, I couldn't do it every day. I only did it 3 times. Great, Mr. Johnson. That's great. Let's try to do it 4 times. I tried to do what you told me. I went, I said, great. Let's work it together. Let's make it a little better. Right? Because they're not a student. They're not trying to get it perfect. They're doing it because they don't feel well and their sugar numbers are high and they are taking their Western medicine and they're still getting side effects. Because every endocrinologist will tell you the diabetics, even when they take their medicines, still get all these symptoms. They still get all sorts of problems. So the Western medicine keeps them alive, but doesn't necessarily solve the problem. The endocrinologists will tell you that. They're like, yeah, it's the best we got. And they know that people get onto a glucophage, like metformin, and then over time they need a stronger glucophage, and over time they need insulin. They know that. And if you can keep them without medicine, great. If you can keep them on a glucophage with the Chinese medicine helping, great. Because if they can stay on a glucophage and never need insulin, great. But you have to be very supportive. Okay, so that's just my suggestion. Think about the potter's wheel, and they'll do it. That's why I would start them sitting. They do it well, so you can bump it up and we can go to standing. You ready for the next level? I'm ready for the next level. Now they feel good, right? Always build them up, build them up. That's your job. Your job is they pay you to be nice to them, even when they're being foolish, right? So that's the thing. Okay. All right. So now we take the same idea and we go to middle burner. So this would be happening in the middle burner, that the yin is cracked, it's broken, and they can't combine. Now if we go to middle burner, and we see here, excessive hunger leads off, right? This is the thirsting part in here is the hunger. You have a profusion of stomach fire, for the stomach yin has been broken. Okay. High food intake, even though they eat a lot, they're emaciated. Diabetics get skinny unless they get medication. They get skinnier. Dry stools or constipation, because that middle dries the fluids. And they also have thirst, right? They'll also eventually have frequent urination. Tongue's yellow coat, sure, forceful, pulse, or slippery, showing the middle burner problem. But don't think this is dampness. Please don't think this is dampness. Okay, it's slippery because the stomach fire is baking the fluids into something like that. But if you treat this to drain damp or transform damp, it won't work. Right? And we're going to talk about the complications in just a minute. But the principle, clear the stomach, drain the fire, nourish up the yin, generate the fluids, but you got to try to fix it. So what do we do to fix it? Well, herb-wise, we can give Yunujian, which is shigao, very cooling. Shu Dihuang, that's the steamed Romani root, right? Maimendong, Zhimu, and Nushi, right? These herbs, Maimendong, which helps nourish fluids and helps in the alimentary canal. Zhimu, which clears fire and strengthens the lower burner, stops the fire from rising. And Nushi, right? Nushi, which cools and drains down and affects the stomach channel, is often used actually for the knee. But it's very cooling and downward. It's settling. So this is Yunujian. Now again, the doses aren't here because you'd modify the doses based on individual presentations. Okay. But this one, now I do have, I believe, let me see for a second. Where's that little picture? There it is. Right, this picture that we had before has a picture of Yunujian. The analysis here, that the Maimendong goes to the top, the Shigao goes to the middle, the Zhimu cools the fire, comes down to sink things down and strengthen the Shudi. Now Shudi, steamed Romania root, rises more than the Shengdi, right? And so this is how these three fundamental herbs in this formula work. And then the Nushi is an envoy to drain it, drive it down, and drive it to stomach channel. Okay. Okay. Also, yes, as Jonathan put up there, Zhimu also helps to generate the fluids by getting rid of the heat and helping the fluids. Exactly. So this is what we call a structural analysis. So if you want to do herbs, we'd draw these structural diagrams of the herbs. Okay. Now, in terms of acupuncture, the same technique that we talked about, right, that we went and we looked at, that same technique, the Binghe Fa, you would do that, but you do it in the middle. On, well, where would it be? CV12, move point for stomach. Right? Maybe liver 13, move point for spleen, because spleen and stomach in the middle burner. Bladder 20 and 21, middle burner. They all could get that technique, right, done on them. Okay. Now you could do them like if you did you could do them front at the same time, CV12, as well as you could do liver 13. You could do all of them at the same time. You say, really? Yeah. If you have one of the massage chairs where they sit up, so you could get in the front CV12, then liver 13, then around to the back, bladder 20 and 21, all of them getting Binghe Fa. That's possible. Then you're time efficient. And maybe if you wanted to leave them 15 minutes, you have an easy time, them sitting in the chair. Now they can also sit up, but no one likes to just sit up at the table and or lie them on the side. You lie them on the side, get to all of those. That's the easy way too. So please don't think that the patient must only lie on the back. It must or lie only on the front. Lie them on the side. Prop them up. Right? Put them in the chair. If you read the Chinese textbooks, they talk about a lot of positions to put the person in. Right? So the same thing, use those positions. In the West, we forget about that and we get used to just the Western clinical position, which is lie down. And that's what we call the missionary position. You just lie down. And that is comfortable for the doctor, not for the patient. Right? So the doctor who wears the lab coat doesn't have to bend over. Patient's on a bed that's high up, so the doctor can keep the nice look with the shirt and the tie. Right? So you may put the patient into a better position. Okay. Now, this middle burner, right? When we're talking about the middle burner, right? The most important thing in here is that a couple of little observations, little things you got to look out for. You will see middle burner based diabetics. They will mess up all sorts of treatments, either treatments of the Western medicine or the Eastern medicine, because they take acid reducers. So acid reducers, like over-the-counter acid reducers. I don't know what brands you have there in Israel, but we have like Tums and Rolaids and Alka-Seltzer, and I'm not sure which ones you have. These are calcium carbonate-based things that sedate your stomach acid.
Yeah, Tums are quite common.
Okay, so you know Tums. Okay, fine. So I'll use Tums as an analogy. The people will, diabetics, if you are a middle burner diabetic, you will have acid reflux. Very common. So fine, if the doctor gives you a prescription, omeprazole or something like that, fine. But if not, many of them take Tums all day. If you're doing that regularly, you're turning off your stomach acid. Maybe you feel better, but you don't digest anymore. And so if you don't digest, how can you get the nutrients that your body needs to take care of the diabetes? That's a problem, isn't it? That's a problem. Okay. So you have to be aware of that. So ask them questions about that when they say they have diabetes. Yeah, do you take Tums? How many do you take a day? I take one a day. Oh, fine. Yeah, 1, 2, sure. 3, fine. Oh, yeah, I take like 12 a day. What? 12 a day. Because maybe they're losing weight, not because their diabetes is so bad, but because they turned off their stomach acid. And if that's the case, you need to get them slowly to come back off the Tums, slowly, little bit. And you need to treat Ren 17. You need to treat Ren 17 and Ren 17 and Ren 14. Because 14, which although it is the heart movement point, controls the sphincter, upper sphincter of the stomach. And Ren 17, you release Ren 17 because that's the point that is also the movement point for the pericardium, and that can ease the pain of acid indigestion. Because otherwise, they could take insulin, it still won't help them because they're hurting themselves by turning off the stomach fire. So far, so good. So you got to be careful. And that's what Qigong is. Qigong is basically heavily with calcium carbonate. So here, unlike in the first one where we said, oh, we're going to take the mother's milk idea and use it. Here we're going to be like, oh, we're going to use this understanding of how you build Unugen, and we're going to say, wait a minute, Qigong, if they're just taking it, because in this beautiful formula, Qigong is balanced with the Shudihuang, the Maimendong, the Zhimu, the Nushi. They're balanced very carefully. But when you get Tums, the rest of the team didn't come with it. So sometimes you have to win by losing. That means take something away. So far, so good?
Do the Western medicine doctors understand the relationship between, say, taking Tums and other antacids and the insulin not working?
Yes. Yes, but the thing is, they do understand it. However, and I don't know what it's exactly like in Israel in terms of the Western medical community. I know in the United States, many times the doctors are very overburdened, too much work to do, and they have trouble following up with all the patients. Maybe that's not a good excuse. Also, patients lie. They don't tell the truth. They don't tell the doctor they're taking Tums. It's available at the supermarket. They're like, "Meh," and they don't tell them. So I can tell a short story. This is not diabetic per se, but I had a patient. She was referred to me. She was the mother of my wife's friend. She was a little older. And she came and she was having lumps forming around her legs. And she was having all sorts of problems. She had knee problems. The doctor was a little confused. He's like, well, maybe we could do a knee replacement, but it doesn't seem to look that bad from the scans. He was like, they were all confused, but she was getting lumps that seemed like they were some sort of deposits in the muscles. So I sat down with her and she wanted to come and get herbs. I said, okay. I had her go through everything that she was taking, every supplement. Now, this kind lady who was Hispanic went to the supermarket, into the Spanish supermarket, and got different supplements good for knees because she had knee pain. And she got a number of things. She was taking 4 or 5 different things for her knees. All of them had calcium. She was on a calcium channel blocker for her heart. And she's taking large dose calcium. And she was getting deposits, calcium deposits in the muscles. She was in pain, couldn't walk right. So I had her stop all the supplements with the calcium. And within 4 or 5 days, she felt better. Within 10 days, she's going up and down the stairs. And her pain's almost gone. And the deposits, after a couple weeks, start shrinking away. So now I didn't really treat her. I treated her by not treating her. I won by losing, by removing from the case. And she didn't need a knee replacement and she didn't need anything like that. She did need some painkiller here and there, the Advil or, paracetamol or, things like that, if she did too much. But she didn't need any major remediation in her knees. But that's because I took a full history. So sometimes you take a full history. Now, do the medical doc, we communicated back to her medical doctor, he said, why was she taking all of those? She thought they would help her knees. Each one individually might help the bone, help the knee. She didn't know any medicine. So now, was it the doctor's fault? Was it the patient's fault? Whose fault was it? There's a question. So, Jonathan, do they know that? Yeah. Did they learn it in medical school? Sure. Do they see it in the journals? Yeah. Do they always know to ask about it? No. Do the patients always tell them the truth? No. We all know that. Patients always tell you what they think you need to know. Maybe they're trying to be helpful. They don't want to burden you. Maybe they don't realize, right? They don't realize. Sometimes some things like cranberry juice can interfere with certain different types of antibiotics, especially for a yeast infection. They don't know to tell the doctor that. And the doctor sometimes fails to mention it. So, all right, but we're not going to talk about Western medicine because it's a complicated subject and we're not going to get anywhere with it. Okay.
We got 2 questions here. One from Marina. She's asking, when you do acupuncture on the bacterial points, do you sometimes cover the patients with their own shirts over the needles?
You can. It depends if they're going to be cold. I try to avoid that myself because the shirt tends to be heavier and can bend the needles. I would rather, if you want to cover it, put one of the thin paper hospital gowns over it. I would prefer that as opposed to their own shirt. I also, if they have a shirt, I'd like to use a clip like they sell them here, they probably sell them there, for potato chip bags. They have a big clip you buy in the supermarket, it's a big plastic clip. And it's to close like a pretzel bag or a potato chip bag, and you just clip it on there. It's big. It's like big and plastic. It's kind of a big clip. I have clips like that. If their shirt is heavy or sweater, you pull it up and you clip it. Or some women have hair clips that they use after the shower, and it's a big clip. Clip like that can hold the clothes in place, right? I prefer that because 2 things. One, I don't want to bend the needle. That's one thing. But more importantly, when I pull that shirt back, sometimes the needle comes with it somehow. And then I gotta, how can I stick my hand in their shirt to look for a needle? Right? So I just look at it logistically a little harder. I might want to use a heat lamp to keep them warm. There's also
Marina is saying what she more accurately meant to ask was also whether after putting the needles in the bacterial points, would you flip them and allow the needles sort of like to press sideways and then maybe treat the front and such?
Oh, the microwave technique. We nicknamed that the microwave technique. That's the nickname we use in English for that, where you needle the back with the needles at an angle, turn them over, they lie down with the needles at an angle, and you treat the front. You can do that. I've done it sometimes. I only like to do that with a patient who's a little fat, to be honest, who's a little heavy. I don't like to do it with very skinny patients because I'm concerned the needle can work in a little more deeply. But if they're a little heavier or muscular, sure, that's a fine technique. Or lie them on the side, right? Either one. So yeah, I have no problems with that. Some patients don't like it. They're like, they feel very nervous about it. So you have to really manage the patient. But that's a fine technique, right? And I would avoid it with anybody who is fidgety. Some patients move a lot. They can't sit still. I don't like it with those people because you got to stay still. But you'll know your patient base. But that would work. That certainly could work. Okay, good.
I had a question comparing the previous formula and this one. The first one seemed almost as if you're using substances that nourish small child, milk, honey, ginger, a lot of food grade herbs. And this one is more of a Unigen, is more of a standard formula with substances that are maybe more typically used for adults. So what's with the more so with the first formula, this type of nourishing?
Well, but okay, two things. One, I don't want to go too deep into formula dynamics because it gets very technical, and we're going to run out of time. I want to get through the lower burner. But the second thing, just to quickly answer the question, if you remember from your fundamental theory, lung is the delicate organ. That's something we say in TCM all the time. Lung is the delicate organ, meaning lung is easily injured. It faces the outside world, right? It's easily thrown off balance. You treat it like a child. You treat it with things that nourish like a child. Stomach's pretty strong. And the issue in the upper burner is you broke the lung yin. Okay? The issue here is you broke the stomach yin. But stomach's tough, hard. Look at the tissue that makes up stomach compared to tissue that makes up lung. So you're hitting it with something hard, shagao. You're hitting it with mymendong, coat. Jermu, cool the fire and make fluid, right? Shudi, right? Heavy. You look at what shudi looks like. It's heavy. And nushi, drive to the stomach. This is much more. It's a stronger formula for a stronger organ, right? It's a fu. That's pretty hardcore. And it's the food that faces the outside world and breaks down food, right? And breaks it in the stomach with the stomach acid. So that's, your stomach's pretty tough, right? So that's why these formulas are very different structure. Okay, good. It's a good question, but just that's as far as we can go with it because it can get really complicated. All right, so far so good. Before we leave the middle burner, right? We talked about watching about the antacids and also the same breathing technique of the one in Wu, but this time you're going to breathe the same forceful breath and a soft breath. But then put your hand on CV12, halfway between the navel and the pubic symphysis, and push that part out. You consolidate in that middle, like you did an explosive sit-up. Like you sneezed from your stomach. What you'll find is that a lot of people are not that strong in their ability to consolidate their muscles, right? And you'll find that diabetics, middle burner diabetics, have a weak middle. The whole middle is mushy. It's a swamp. Okay, so that's that technique. Again, stuff you can use. Today is stuff you can use. And certainly if you come and hang out for the rest of the 10 weeks, there's more stuff you can use and more techniques and more this and more that. But I want you to go home with stuff you can put into practice today and say, all right, I got some stuff out of this. Okay. All right, on we go. We got one more burner. We got to talk about some complications. Okay. Lower burner. Oh, the classic depletion of kidney yin, but it's broken. It's leaking. Frequent urination. It's the same problem. The same problem you have here, right? Whoops, right here, where it's draining down, things going up, and it's not just yin deficiency, it's broken. That's why it's wasting and thirsting. But the urine drains out. Copious, turbid, milky urine. Well, that's not right. That's not right. It's like it's leaking out essence. That's not right. Dry mouth and lips while the kidney's not able to return the force up. And of course, that untethered yang, the thirsting part, dries everything. Okay, of course, thirst also comes at us. A lot of fluid intake. Of course, the weak, achy, low back and knees, because that's what kidney governs, sure. Dizziness and vertigo as kidney cannot keep down heart, right? That's the kidney-heart communication. Blurry vision, that's the kidney not helping the liver, because the liver governs the eyes. And red cheeks, the classic malar flush. Sure. Okay, also, with this, bad skin. Bad skin. Not terrible. They don't look like they're a teenager, but their skin has crenulations and lumps and looks a little bit like kind of bumpy, lumpy fabric or leather. Okay, and little small pimples, right? Little small pimples. Okay. Red tongue, not a lot of coat. You just pick the tongue out easy. Deep, rapid, or thready pulse. Those are all possibilities. Deep or rapid or thready or all of them. That's the commas mean. Could be all three. It doesn't have to be all three. Nurse kidney in, but secure the kidney. Secure the kidney. Because this is, falling apart here. Okay. The classic form, of course, is Lu Wei Di Huang Wan, which you know. Now, Shu Di Huang, Shan Yao, Fu Ling, Mudan Pi, Zi Xie, San Su Yu. Okay, fine. Cool. Okay. What are we going to take out of this? Now we're going to do a secret. Well, not really a secret because I'm going to tell you. Okay. For the lower burner one, first of all, we all know Shu Di Huang and his cousin or his other form, Sheng Di Huang. Those are premier ones for the blood and for the kidney. But now, for diabetics, there is I hesitate to say secret, there is a traditional, that's a better word, a traditional preparation where you take Shu Di Huang, which is the steamed one, and the Sheng Di Huang, the raw one, and you put them together with salt. So even amounts of it. In other words, 12 grams Shu Di Huang, 12 grams Sheng Di Huang, 2 grams salt. And you pack them together with salt. You put it together in a jar. You put it in the jar. You add enough water just to cover the herbs. You put them in the sunlight. They have to sit in the sunlight for 3 days. After they sit in the sunlight for 3 days, where they get sun every day for 3 days, then you boil them for approximately between 20 minutes and 30 minutes. Low, 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 low. Really, 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 really low. Okay, not a rolling boil. Little simmer. Okay, and then you take that and you give the person a small glass, approximately 250 milliliters, like the little cups that come with the cough syrup, about 250 milliliters, right? And you take that once a day. That is considered, that's a very traditional formula for how to reconsolidate the kidney and bind the yin and yang back together. Okay, why? Shu Di Huang, steamed, opened up, rising. Sheng Di Huang, raw, but both of them affecting the kidney. And the salt, for salt is the flavor of kidney. Right, and it's the salt is what comes traditionally. It's sea salt, right? It would be natural salt, not the iodized salt. And I'm sure you guys have lots of sea salt there. That's an easy thing to get, right? Okay, but that's a very simple method. Okay, all right.
So how do we relate that particular formula you just described to Liu Di?
It's not from Liu Di, but we're saying Liu Di. Again, today we're taking individual things from the formulas that we can use, and you can use whether you're a big herbalist or not, but I'm giving from the standard TCM endocrinology textbooks, what are the standard formulas that are the base formulas for each burner. Liu Di is the base one for lower burner, Unigen for the middle, and Shaokafang for the upper. That's the standard they're using right now. Right? And so that's why bring that forward to say, okay, these are the ingredients. Then you would, and even in Liu Di we can alter the level of the ingredients. But specialized technique from the first one, using the mother's milk or the baby formula. From the second one, avoiding and understanding the relationship of shigao or the antacid. And here from the third one, specialized technique using Shu Di Huang. Right? That's why I brought these three formulas forward to say, okay, now there's some specialized things, some things that you wouldn't find in the textbook. That's why I wanted to go over with people that are not too hard to actualize. Right? Because also I want the stuff that we did today, you put into practice right away.
So that special Shudi and Shangdi combined formula with salt, do we take it instead of Liu Di or with it?
That is a special formulation that will help to consolidate and bind the kidney yin and yang back together. So you could use it for a diabetic, you could use it for someone who's taking chemo, you could use it for someone who has atrophy atony disorder, you could use it for someone who has had a terrible event and their kidneys have been run down, right? But you could use it and then work with them with Liu Di, you'd have to adjust the dose a little bit, but you could use that for 10 days, get a good consolidation going, switch to Liu Di. Okay? Because remember, herbs don't work forever. Your body builds resistance. So maybe you got to go Liu Di and then you got to switch out. Maybe you got to switch to something else and go intermittently between consolidate kidney, strengthen the whole thing.
So the Shudi Shangdi with salt, would that also help the kidneys to grasp the qi?
Yes, it could be used for asthma to grasp the qi. It reconsolidates the kidney, strengthens the kidney, and binds together the yin and the yang in the kidney. Okay, good. All right, so now, in terms of acupuncture, we have that technique we've been working on. With that technique that we talked about, right, the Bing He Fa, you could do this here, of course, on the kidney back shu and the kidney front mu, gallbladder 25, which is very close to bladder 23, right? So those would do really well together. You can also do it on Ren 4, right? CV4, because that's where we get the yin yang qi and blood very strong, okay? Then spleen 6. On spleen 6. Why on spleen 6? Because it's the 3 yin crossing point. Really helps the lower burner yin, right? Helps to reconsolidate that. Okay, that's the acupuncture part. The Qigong part would be, the same breathing, right? That forceful woo, the one, and then down. Put your hand on your lower dantian from your belly button down to your pubic symphysis and push that out. As if you pushed a car out of the, I can't say car out of the snow. You guys don't have that. Car out of the sand. Right? And boom, push. Right? Boom. If you strengthen your lower dantian that way, your acupuncture will get better. That's you, not even talking about the patient. If you do that practice regularly, you will get stronger in your qi and you will do better acupuncture. And you'll be able to stand longer. Because we all know, as clinicians, we stand a lot, right? Unless you're doing herbs, you're not sitting at your desk that often. You got to stand and do Tuinan, stand and do the acupuncture, and stand and stand and stand. Okay. All right. So that's all lower burner. Now, food-wise for the lower burner, for our friend the diabetic, okay? One of the best things for them is seaweed. Seaweed. Now, the highly salted seaweed that they have in the Japanese restaurants for sushi is too much added salt. But the natural seaweed, the Japanese say wakame, the Koreans say kim, right? The seaweed soup, the seaweed. That's an easy food addition. And whenever we do food therapy, we add before we subtract. Please remember that. Whenever you do food therapy, you add before you subtract. If you're going to give someone a diet, you tell them, add these things. Then tell them, avoid these things. Don't tell them, avoid these things. Then go backwards and say, add these things. No, no, no. If you do that, they will not follow you. Nobody wants less. Everyone wants more. Psychologically, give them more first, then less second. Okay? Whether it's the same truth. Tell them more first, less second. Okay? And
Is the seaweed being mentioned here the same as the herb Heidel?
Heidel as an herb is a concentrated form. Is in some sense yes, but the thing is, Heidel is the whole plant. When they take the seaweed, they take the upper part and they clip it, and they don't include the lower part, and it's tastier. But ultimately, yes, it's also less concentrated. Whenever we make anything into an herb, we concentrate and boil it for a longer time and take out the metabolites.
So is it still incompatible with Gansa?
In diet therapy, barely, because it's the whole plant and it's a small amount, and there's not enough concentration of chemical for it to become a problem. Okay, right. All right, so far so good. Now, we're not able to do all this today. We're actually running out of time at this point, but these are all clinical complications that come from these three basic things, from the lower, middle, and upper that eventually poison each other. And then they lead to all these things: spleen qi deficiency or liver qi stagnation generating heat, liver qi invading the stomach, qi and yin dual vacuity. And that's weird because qi and yin don't like to hang out together, but they can both be deficient. Phlegm heat, heart and lung dual vacuity, heart and spleen dual vacuity, heart and kidney not communicating, liver blood vacuity, spleen and kidney yang vacuity, blood stagnation. Oh my goodness. Well, over the next 10 weeks, we're going to talk about these patterns and about specialized ways to treat them and identify them. And this is where people often go awry. They make a mistake because they say, oh, they see the spleen qi deficiency, or they see the heart and lung dual vacuity, and they try to just treat that as the primary thing outside the context of the person having Xiaoke. And this underlying problem in the burners makes it much harder to simply treat the thing that you see. So in TCM 101, the basic, we treat what we see. We get real complicated. We have to treat the underlying situation plus what we see. We have to treat them in concert. So that's part of what we're going to focus on going forward, so that way you know what's going on with that. Okay. Now just a couple more things we want to talk about today before we get going. All right. So I'm going to talk for a second about peripheral neuropathy, right, and mention something about that. Okay. And then I want to mention a very specialized technique, one more protocol that can help you with your patient. So ongoing Xiaoke, wasting and thirsting, interferes with the qi transformative mechanism, how the body makes qi, and the blood transformative mechanism, how you make blood. At first, it leads to a deficiency of qi and blood. That's the first thing. So they get a lot of fatigue. The deficiency of blood results in numbness, and a numbness because blood deficiency makes you numb, and unresponsiveness. That's in the peripheral neuropathy. So that makes the numbness. Okay. But underlyingly, the yin is broken and there's a yin deficiency and there's an empty heat. Well, combine that with the deficiency of blood, you get blood stasis in the network vessels. That's the lower vessels and the periphery. That gives you sharp pains. That's the sharp pain of the peripheral neuropathy. And it slows the healing that we see with peripheral neuropathy. Those things happen there. Okay. Then treatment of this, you have to resolve the blood stasis. That's one part of it in the surface. And then you have to nourish the blood. But treating peripheral neuropathy does not change your sugar levels. So you can alleviate the blood stasis, you can treat the underlying blood deficiency, you can do all that. It doesn't change the sugar count. Treating the primary aspects treats the sugar count. But ironically, many of the things we use, like Shu Di Huang, right, many things that we use that help build up and restore that yin, don't necessarily help with the blood stasis on the surface. Okay, so that's mentioning this, mention the pathomechanism of it, and this is what going forward we're going to have to be looking at protocols for how to do this. Okay, one thing I will mention is magnesium cream. Magnesium cream helps the people with diabetic peripheral neuropathy, especially if you do Tui Na. And now with Tui Na, we use a lot of liniments and a lot of Chinese herbs, but magnesium cream, which you can get, the cream has magnesium, it's good for muscle things. Not Epsom salts to soak in, but magnesium cream, using it to rub in while you do Tui Na on the legs or the area of the peripheral neuropathy really seems to help a lot. Okay.
Can we mix the magnesium cream with other Tui Na oils, such as carrier oils or even Honghua oil and such?
Although you can, magnesium cream's kind of thick. It's kind of thick. It's kind of like thick like sunscreen. So my suggestion would be do the Honghua oil, the other oils first, then put on the magnesium cream and rub it in. But it does a lot of good to improve the circulation, ease the muscle. It's really effective. So, but I would kind of do it as 2 layers, like a second layer, because it doesn't combine well with things because it's thick. Okay, like you have a hard time mixing it. You know. Okay. All right. Then mental
when we use magnesium cream, how long term is it? Is it something that the patient has to use for decades, or is it something that?
Well, it's affecting the circulation, it's affecting the muscle, it's improving that circulation. If you're following a good protocol and you're using things that invigorate, if it's very blood stagnant, things that break blood stasis, then using the magnesium cream to assist the muscle, right? Then over time, your treatment plan should proceed, and then you'd see the blood stasis start to resolve, and you start to see the underlying blood deficiency. In which case you switch to herbs that help the blood deficiency in the surface, maybe still use a magnesium cream, and then eventually you can get it to where you don't need the magnesium cream. So it's not necessarily an analgesic to get rid of pain, it's trying to support the normal physiology where there is the magnesium dynamic in the muscles that the peripheral neuropathy, that the diabetes has damaged, that has thrown off. So it's using that to try to correct it so that you have proper lymphatic drainage, you have proper drainage of cytotoxins, you have proper drainage of lactic acid, you're supporting the normal metabolism that way. Okay, all right. So now, mental degradation. Ooh, it got worse. Wasting and thirsting syndrome can progress past the deficiency of qi to then lead to damp formation because the heat from the deficiency interferes with the qi transformative mechanism. Over time, the damp will proceed to phlegm. And then, because the yin deficiency, empty heat continues to bake it. Then the empty heat dynamic leads to a general vexation of the heart. You get irritated and a perpetual, ongoing Shen disturbance. So this can lead to phlegm, to miss the mind, creates a cognitive dissonance. And this is what we now call diabetes type 3. Right? This is now called type 3 diabetes in Western literature, where it starts to form amyloid plaque formations in the brain and other problems in the brain. It can lead to what in TCM we call Dien syndrome. And those of you who did our mental emotional class are familiar with Dien syndrome. It can become delusional. So if you're treating this, you have to focus to open the orifices, cool the heart heat, stabilize the mind, calm the Shen, and address the underlying problem in the 3 burners, the Shaoke. So I'm just putting this here because it's complicated. Okay. Last part of this, right, is that these are often, the patient with diabetes has a complex of pure patterns and clinical complications mixed together. Herb formulas have to attend to the primary insult, but the formulas simultaneously have to address the clinical complications because that's where they get the symptoms and the degrading functions. So challenge to create an effective formula with the root and branch, and then in the geriatric population, because geriatric people are pure yin, their metabolism runs more on yin. Well, wasting and thirsting syndrome has a faster and more detrimental effect. Treatment of the geriatric patient requires high attention to the regularity of the treatments, adherence to the dosage schedules of the medicines, and also proper identification of the derivative pathologies as compared to other neurological and mental concerns is central if you're going to manage that. Okay. All right, that's all our slides. There's one more thing I want us to mention, and then we're going to wrap it up for the day. Now, Last thing, there's a protocol that was actually developed in Mexico. It's a Mexican TCM protocol from a Mexican TCM university. And they developed an approach that's really effective. It's very simple. They use it across the board for diabetes. I'm going to explain it to you right now. So you can use it today, or I guess tomorrow because it's late night there. You needle at T8, at the 8th thoracic vertebra, at the Huatojiaji point at T8. You needle there. You needle at Ishu, right? Everyone knows Ishu, pancreas shoe point? Does anybody know Ishu, pancreas shoe point? You've heard of this? If not, then it's a good thing I mentioned it. I will, right here, I'm going to pop this up and I'm going to share screen and we're going to write this out and you're going to get this, you're going to see it right here, okay? So this is the protocol, right? This is the Mexican, whoops, can't spell. I'm going to make this bigger so you guys can see it better.
As the professor is putting all of this in, I just want to remind everybody that he skimmed through several topics, such as the treatment of geriatrics and various combined pathologies and complications. We are going to be, he is going to be addressing all of this in the extended seminar. So this is the first of 10 classes, and it is possible to sign up for the next 9 classes, which would be paid for. So if you'd like more information, you can contact me on WhatsApp and sign up. We already have a few future attendees. Just reach out later, okay, after this class.
Pancreas point bilaterally. Now the pancreas point, issue is 1.5 sun lateral to T8. Oops, T8. Okay. Why does it give me a hard time with that? Because it wants to. There we go. 3. Easton, just put that there. I'm slightly computer literate, but not very. Why did it do that? Did that just to confound me? Put the 2 there. Backspace there. Okay. Easton at 50 hertz from the red clip, issue the black clip. Okay, that's the whole thing. So it's very straightforward. Okay, so let's go over this. We'll make it even bigger so it's gigantic on the screen. There we go. And I can certainly send you this little thing, but it's simple. Okay, so this protocol developed by one of the Mexican universities. You needle 1.5 sun deep at the Huatojiaji point at T8. At T8. Then you needle Ishu. Ishu is the pancreas point. E is the Chinese word for pancreas. That's a modern determined point. It's discovered in the modern day, right? Because we know that T8, we say, oh, there's no traditional acupuncture point there on the bladder channel, but there is this modern discovered one called the pancreas point, the Ishu point. And so this is 1.5 sun lateral to T8. This is where you find that point. Okay, you needle that point on both sides. Now, how deep do you needle that one? It depends on how big the person is, because it's safe to needle it. It's not too high, but you can go, roughly somewhere between 1 sun, right, 1 to 1.5 sun, depending on the person's size, and you can angle the needle if you're uncomfortable with it going straight. Okay. Then put Easton, electrical stimulation, at 50 hertz, right? That has the red clip at the Huatojiaji point and the black clip at Ishu. So there's one on each side. And you run the electricity. You bring the intensity up to where they feel it, but it doesn't hurt. And you run that for 25 minutes. That's their protocol. This protocol shows reduction in sugar and in A1C. Now, you have to build the protocol. That's one part of a larger treatment, of course, because you still have to address the things that we talked about in terms of which burner, in terms of any kind of comorbidities, other problems they have, things like this. But this is very effective. I only learned this a couple of years ago, like two and a half years ago, and started using this. This I found I'm a reader for a journal, and this was research that I had read for the journal. Right, and this is really, really, really effective. Now, this here, I had a patient who he had no health insurance. This is a problem in the United States. He had no health insurance, and his immigration status was not clear, if you understand what I mean. So he couldn't get health insurance very easily. He needed medication. His A1C measure was 13, very high. His daily sugar reading was 450, way too high, very dangerous. Doing this protocol only once a week, because that's all he could come in for. Once a week with the rest of the treatment built around it. But this protocol brought his A1C down took us about 2 months, a little over 2 months, about 10 weeks, roughly 10 weeks. We brought it down to 7. Down to 7. And his daily sugar readings down to 135, between 135 and 150. Still a little high, but not bad.
And that was without herbs?
That was without herbs. So this is really effective. Really effective. Now he did change his diet. He started eating better. He was listening, but he didn't have a lot of money to buy things and to whatnot. And, he was not functioning well, and he had a lot of neuropathic pain. Now his neuropathic pain went fast. 2-3 weeks, neuropathic pain was gone. But the larger sugar issues took time. Okay. All right.
So when you speak about issue, that's bladder 17.5.
We don't call it that, but yeah, it's halfway between bladder. It's not, well, because remember, you have bladder 17 is a T7. Bladder 18 is a T9. It's between those two.
Yeah, here in Israel, some call it 17.5.
Well, we tend, at least in the US, we tend not to use the word for half unless it's half a sun away. Right? So we say like liver 8.5 is half a sun off liver 8. So we tend to use it, but yes, but bottom line is it's halfway between 17 and 18, whatever you want to call it. But it's properly called Ishu. It's recorded in the Chinese textbooks now. It was determined in the early part of the 20th century. And it has a lot of data on it in general. But this specific protocol at 50 hertz is coming from one of the Mexican universities. Okay. All right. So use this. Put it in your treatments. Use this stuff. The goal of this is to use it so your patients benefit, right? They all, hopefully everything we did today, that needle technique, right? The Bing Hefa technique, right? The understanding of some specific herbal things we could take out, some specific food things we can suggest, right? The Qigong, that's very straightforward, not too involved, right? Put that together with this understanding also, perhaps this protocol that we just went over. This protocol is what we call Heyi. Heyi means integrated medicine between Western and Eastern ideas coming together, because this is based on what nerves run and which nerves innervate the pancreas and where they come out from the back using the Huatujiaji, plus the empirically discovered pancreas point, plus the understanding of electricity, which is modern, plus couching it within a larger classical traditional Chinese medical treatment format. Okay, so all of that tied together, so that we could bring the best benefit to the patient. Okay, well, that's as far as we get to take it today. Right, we ran about 20 minutes over, which is not bad for me. Sometimes I go a lot longer over, right? So, but as Jonathan mentioned, we're going to keep going with this seminar and go on for another 9 weeks and expand on the things that are here. So hopefully, if you found this interesting and it was cool stuff and stuff that you could actualize, we hope to see you going forward in that. Okay, but if you can't because schedule whatever, hopefully this gave you some insights and some things that you can use and help the patients in the clinic. Okay. Great. Jonathan, anything else?
חברים, עוד שאלות? Any further questions? So we have something here. Oh, if you can just write in the chat or describe once more, how do you combine the Shangdi Huang and the Shudi Huang with salt to create that particular formula?
Sure. So, how about this? How about let me type it up on this right underneath this Mexican protocol, so it goes up on the screen, and then I'll just dump it into the chat right after that. Okay. Okay. Give me 1 second. So I have a
meanwhile, as the professor is putting this in, any further questions, if you want to come in and ask or write in the chat.
Okay, there we go. All right, so here we go. There we go. All right, this is the Dihuang description for consolidated kidney. Okay, so 12 grams Shu Dihuang plus 12 grams Shen Dihuang plus 2 grams sea salt. Okay. Combine the glass jar with enough water to cover the herbs. Let it sit in the sun for 3 days. Okay. Nope. Let's let it sit in the sun for 3 days, and then after it sits in the sun for 3 days, then the liquid will boil. Take it. Simmer. All right, there we go. Okay, 12 grams Shu Dihuang, 12 grams Sheng Dihuang, plus 2 grams sea salt. Combine in a glass jar with enough water to cover the herbs. Let's sit in the sun for 3 days. Take and boil, not a boil, take and boil on a very low simmer for about 20 to 30 minutes, not too long. And then ingest approximately 250 milliliters daily for 10 days. It's got to soak in the sun. Okay.
Well, if you would like to do that, you need to prepare quite an amount. So you have to have several jars, because if they're taking 250 milliliters a day, that's a liter over 4 days.
I'm sorry. 25 milliliters.
Yes, all right.
Sorry. I'm coming from the English system, working in a metric system. I'm trying my best there. That's not my strong point. No, little bit. 25 milliliters. Sorry, not 250. Sorry. Thankfully, you caught me on that. I'm glad. Okay, but it's a small amount. A little bit every day. Almost like we call a shot glass. A little bit. Okay, small amount.
Okay. And they just take 1 shot glass a day.
Correct.
So in one go, one portion.
Once down. Yep. For 10 days.
Before or after meals, during a meal?
Doesn't matter. Usually, though, historically, it's done either at dawn or sunset. Historically. Why? That's where yin and yang are meeting. Okay. Does that make a big difference? I don't really know. I don't know of a study that shows that. But, it's probably easier at sunset than dawn, but it depends on the patient. But it's done when the yin and the yang are equally balanced right there. All right. Does that really help? Find out. Try it. Maybe you got a journal article out of it. Okay. All right. So I can take this also and put this into the chat for everybody if you want that in the chat that way. And I can send this. I'll send this also to Jonathan. Okay. All right, someone asked a question in the chat. Dana put, is the body form showing retention of fluids in the different burners an accurate diagnosis to which burner is most compromised? Yes, but with the proviso that you also have to look at what is the historical first symptom. Did it start with a lot of thirst, start with a lot of hunger, start with a lot of urination, right? Because also that other swelling in the body can be due to what we call comorbidities, meaning if it's gone on a long time and then they wind up also with spleen qi deficiency or also with liver qi stagnation, or also those other things can cause changes in the body that mask it. Okay, but yes, if it's early on, then yes, that's a very clear thing. Okay. All right. All right. Other questions, or should we wrap it up? Okay. Well, I'm getting some thank yous in the chat, so I'll take that as a sign that over there also probably, what is it? Was it 10:30 already?
Yeah, it's 10:30.
Okay, so here's the thing. You all should pat yourself on the back because you went the extra mile for your patients today, staying up to 10:30 trying to figure out what to do. So that's a good thing. Okay. All right. So we're going to end for today. I hope you guys enjoyed that. I'm going to send Jonathan the recording. He'll send it out to all of you, as well as the files that we used and such. And then if you have questions, you can certainly get back to us on that. And otherwise, hope to see you, in that ongoing seminar. All right. So have a great night. All right. Thank you so much. All right. I'll talk to you all soon. Have a great night. Bye-bye.